Before we jump into this episode, I want to remind you that while Caitlin and Sophia are dietitians, we're not your dietitians. This means the information shared in the Food Freedom Fertility podcast is intended to entertain, educate, and inform. It is not a substitute for medical care. This information is not intended to diagnose, manage, or treat disease. Always consult with your doctor before making any changes.
Okay, ladies and the few gentlemen that listen to us, we have a new segment of our show. We love how you love the Yeah Girl segment, and this is Connection Corner. Sophia, what's Connection Corner?
So this is where we are going to basically read back to you the things that you say to us, because believe it or not, we actually do read your comments, we read your reviews. We want to connect with you, and we want to know how each episode is resonating with you, because if it's not connecting with you, what are we even doing here? You are the reason we're doing this podcast, because we want you to hear the things that you need to hear. We want you to be supported. We want you to feel like you are a part of our community, because you are. And this is how we're going to connect with you. Connections Corner, where we're going to read today, for the very first time, a review from a valued listener named Krista.
So here we go. Krista, podcast listener. This is from January 2024. Her subject is Most Valuable TTC Resource. This podcast has been the absolute most valuable resource I've found over the past year of trying to conceive. The information that Caitlin and Sophia provide has helped me better understand my body, make positive lifestyle and diet changes, and made me feel more empowered by understanding my options and next steps I can take. Their openness, transparency, humor, and encouragement has helped me feel more open to talking about my journey and not feeling shame around the difficulties. Thank you, Caitlin and Sophia.
Thank you, Krista, for this stellar review. And listener, I want you to know that every time that you rate, review, subscribe, you are helping other ladies find us as a resource. The algorithm is real, and this is how people find us. So thank you very much, Krista. We're so happy to have you listening. Welcome to another episode of Food, Freedom, and Fertility. We are your hosts, Sophia, Pavia, and Caitlin Johnson, both registered dietitian nutritionists, both specializing in women's health and fertility, and we're pumped that you are here today. We are joined by a special guest, Dr. Jordi, who's a naturopathic doctor working at Thrive Collective, which is a nonprofit maternal, pediatric, every kind of women's health care surrounding motherhood here in San Diego, and she also graduated from my alma mater, Bastyr University. So we are pumped to have her on the show today. Dr. Jordi, welcome.
Hi, Sophia. Thank you so much for having me.
We are really happy to have you on, and it feels so silly to be recording like this because, listeners, Dr. Jordi's house, if I stood on my roof and yelled, she could hear me. She lives so close, and we didn't even know that when we met, which was so funny. We met at like a networking event kind of thing like a year ago. No, Jenny was born. My daughter was born. She was little though.
It was at that needed dinner.
Mm-hmm.
Yeah.
Like 6 months ago. And so anyway, the nonprofit that she works for, they had a fundraiser, and my husband and I went to it, and I went to the restroom, and when I came out, my husband was talking to who I thought was the only other dude there. And so I was like, oh yeah, you found the only other dude here, because it was like an airing of a birth documentary, and it was at a hard kombucha place. It's like pretty girly. But so they're talking together, and I just like walk up and laugh, and I'm like, did you find the only other guy here and talk to him? And my husband, Louis, was like, no, I was standing here trying to look comfortable and I heard somebody say, hey, Wahoo. And he was like, Wahoo? I haven't been called Wahoo in years. And turns around, and it's Jordi's husband. Turns out our husbands went to comm school together like 10 years ago or something like that. And my husband's call sign was Wahoo. And that's how they called each other. Hers was Sculpin and mine was Wahoo. And so that's how they remembered each other. And so it was so funny. So then we got to chatting and then realized not only do our husbands know each other, but she lives like less than a mile from my house. And so we were like, this is so perfect. And just her curly hair and her beautiful smile and her wonderful personality and passion for helping mothers really just, we had to have her on. So here she is.
Your
Dr.
curly
Jordi.
hair is like, it's everything I want in my life.
It is, I know.
I'm teasing.
I always ooh and ah
It
over
is
her.
beautiful though.
And what's
Thank
so
you.
funny is the Tourmaline Birth Center. It's like curly hair center. Like, so Dr. Jordi sort of works adjacently to Tourmaline Birth Center, and the owners, Allison, has like the most beautiful curly hair. We're gonna have her on the show soon. And then Maral, she has the curliest hair, and then Jordi works there, and it's not curly hair like what you'd think of. It's like movie curly hair. Like a princess, like how it's these like flowing locks. Anyway, if you're watching on the YouTube channel, you can see what we're talking about. We're making Dr. Jordi blush here.
Gosh, I know.
But
Thank
she
you.
but she is a very intelligent and skilled physician, so maybe let's not make it all about her appearance on the show. We're like really
Well, what's funny
perpetuating some
about that?
stereotypes here.
What's funny about that, though, is sometimes I'll do Q&As on my Instagram, expecting medical questions, things like that. Every single time I get questions, what do you do with your hair? What products do you use in your hair? Things like that.
Curly hair
It's
squad.
No, it
Yeah.
looks really good. But
Thank
it's
you.
just, yes, she's not just a pretty face, everybody. She's also incredibly talented and very passionate and a wonderful asset to you, our listener here. So we're very happy to have you on the show. So Dr. Jordi, can you just sort of talk to us about, I don't know, tell us the kind of work that you're up to, how you're serving women at this time. Give us the sort of intro to
I
what
also
you're up
want
to.
to know, like, how'd you end up there? Like, because what you do is really specific. So when you tell everybody what specifically you do, like, how'd you fall there? How'd you end up in a naturopathic school? I want to know those things too.
Definitely, yes. Let me start with that because I'm a pediatric naturopathic doctor. I work with both pediatrics and fertility. And so I got here in an interesting way. I always wanted to be a pediatrician. I just always assumed that I had to go the conventional medical route because that's what everyone did, right? I shadowed a lot of different types of doctors in hospitals and outpatient centers, and they got like 15 minutes with the patient, didn't really get to know them. And it just wasn't the model of care that I liked, but I was going to do it anyway, and then I was like, maybe I'll become a registered dietitian. Maybe I'll become a psychologist. I kind of had one of those, oh my gosh, I want to make sure that I am going in the right direction moments in undergrad, right? And then I started seeing a naturopathic doctor myself. Some of my family members started seeing a naturopathic doctor, started shadowing them. They spent an hour with me, went over labs, in depth, taught me things, and I was like, this is the smartest doctor I've ever seen. And then I started looking into it more and just right off the bat was like, you know what, this is what I'm going to do. Put all my eggs in that basket and haven't looked back, and I'm so happy that I did it. In medical school, I did a lot of work with autoimmunity as well. And a lot of the things that would lead to autoimmunity outside of genetics are preventable, and especially from childhood, whether it be imbalances in the gut microbiome, in the immune system, all these different things. I realized a lot of my patients were saying, I wish I knew this when I was younger, right? And so that coupled with parents saying, I just don't love going to the pediatrician, my well child appointments. I feel like I'm being forced to do things I don't want to do, or they just, push antibiotics on me, whatever it might be. And I really was able to develop a model of care that I would want for my own children. And so that means I do holistic well child exams, bridging conventional medicine and alternative medicine. I like to really bridge that gap because there are great things from both sides that we can give to families. That being, I do all of the well child exams, developmental milestones, physical exams. I just also pair that with improving gut health. Here's how to introduce foods properly, introduce allergens, development, things like that, coming from a holistic mindset. So that led me to meeting the people at Tourmaline Birth and Wellness Collective, mainly Allison. She's also our executive director of our nonprofit. And it was to be working at Tourmaline, right? She was like, oh, we need someone in pediatrics. She also started talking about her nonprofit. And I was like, hey, I actually have a background in nonprofit work. My husband is on the board of a nonprofit that aims to provide service members with rehabilitative support and equipment. And so I've been working with that, and then I started talking to Allison and was like, you know what? Your nonprofit clicks with me. Started working with them, and that is Thrive. So that leads
The
me to...
nonprofit is Thrive.
Yes, the nonprofit is Thrive. So that leads me to Thrive Wellness Collective. We are a 501c3 nonprofit organization that aims to provide holistic maternal health services to families of all incomes.
Wow, that was a mouthful.
I know.
Thank you. I know. So we were supposed to, this mysterious Allison we keep referencing. She was going to be our guest today, but she is going to be our next guest on the show. So it might be sounding sort of like we're talking about someone and you're like, who the hell is that? But she is going to be coming on soon. She had an injury, so she's not here today. But okay, Jordi, thank you for telling us all of that. And I think part of what our listeners are wanting to know right now, because most of our listeners are trying to get pregnant, is, okay, what is this tourmaline that you keep saying? And what are these services? Why would I need this? Can you just speak to that for us?
Certainly. So Tourmaline Birth and Wellness Collective is where Thrive is able to provide its services through. Tourmaline is a birth and wellness collective, so it has both birth services, including 2 beautiful birthing suites, and practitioners such as myself, a naturopathic doctor. We have pelvic floor therapy, acupuncture, massage, all types of things. And so part of why we founded Thrive is so that we're able to provide these beautiful services to people who can't afford it.
Because y'all don't take insurance there, right?
No, we don't take insurance.
Very, very markedly, they don't take insurance because it really frees them up to be a lot more agile in how they're going to care for people.
Exactly. We provide 60 to 90-minute appointments for prenatals. We also provide preconception care. We provide all labs, ultrasounds, birth prep, educational courses. We also provide prenatal yoga, consults with a therapist. So these are all different things that would not be able to be provided under insurance model.
And it really, I mean, having been a client there, I just went in for a little postpartum care. I didn't have my babies there, but going there, you really get sort of the vibe of, I don't want to say tribal community birth, but I feel like that's maybe appropriating something I don't quite understand, but it sort of gives you the community birth feel because there's, like she said, like classes and courses and meetups and other services that are just like postpartum care. Like I went there for a steaming service. I went there, I had just like a nice cup of tea and just relaxed in one of their hammocky chairs. Like there's really sort of like they're creating more of a community birth vibe to where it's not so clinical, it's not so sterile, it's not like you show up, you punch out your baby, as soon as we're, sure that you're not going to die, we send you on your way. It's more like you're being enveloped, you're being, what's the right word? I don't want to say initiated, but it's like, because that sounds sort of dark. But it's sort of like you're being ushered into this motherly role in your life by other seasoned mothers, by other pregnant women, by practitioners who do this professionally. Like you're kind of getting welcomed into this new identity of mother, and it's very holistic. So and it's beautiful as well. Very simple aesthetic, very beautiful. And passionate women who kind of don't give an F, if you get what I mean. Like there's a reason they're not like bowing down to the gods of sharp healthcare system and all of that. They want to be able to take care of you the way that they want to take care of you and think you need, and not wait 6 months for something to get approved or denied and then have to go to court and explain why they thought you should whatever. So it's very welcoming.
Good. I'm happy to hear that.
Yeah. So, okay, Dr. Jordi, tell us, okay, so a lot of our listeners have sort of been to the doctor, hey, I want to have a baby. I thought that I would just have sex and have a baby. Or some people even think they need like to get cleared from the doctor before they can try to get pregnant. How is what you're doing and what the collective that you're working with, what you guys are doing, maybe different or similar? Like, what's the experience like for someone who wants to get pregnant?
Yes, so it actually is wildly different. Oftentimes, as many of your listeners I'm sure have experienced, you go to the doctor, kind of wait for that clearing, or, you have questions, and it's just kind of like, well, it's either you get pregnant naturally or, you go for IVF, right? And so we just really come at the standpoint of, again, community. You build this community of people in the same boat. You talk to practitioners that allow you to nourish yourself and rest and really put that energy towards getting pregnant. And what I like to say is getting rid of those obstacles in your way, whether it be environmental toxins or lack of nourishing foods. I have a lot of patients that have come to me from conventional medical side, and they've never really talked about diet, which I know is you guys' MO, right?
That's our whole bag of beans. Yeah.
Exactly. I'm like, oh, you aren't eating protein or, balancing your blood sugar, things like that. And we really encourage families to nourish themselves in that preconception period.
All right. So what about, okay, so someone comes in, I want to get pregnant. Where do you traditionally start with someone like that?
So I always start with a baseline. We want to do labs so I can see what's going on internally. If there's anything
Already
that we can...
vastly different.
Yes.
Okay, like half our episodes here are like how to talk to your doctor about labs to where they'll actually say yes. Or like how to go get labs on your own, which is so sad because you're going to get this printout that you don't even know your ass from your elbow when you're looking at it. And you're like, what is MCV? I don't even know what that is. But I see here that it says hi and it's in red. So I know that that's not good. Like, what do I do now? Okay, so you start off with labs.
Yes, and to that point, hormones, they aren't flagged as high or low. There's specific times in your cycle that you're supposed to get them done, as you know. So it's all of that kind of stuff. So we run comprehensive labs, see what's going on internally. I also then start with nutrition and lifestyle. So that's kind of our baseline initial appointment. Once we've come across different factors as far as, ovarian reserve, as far as, cysts, whatever it might be that their actual medical history involves, then we can kind of dive deeper into each of those things. But I always like to make sure that we have an insight into what's going on inside the body, as well as nourishing them with nutrition, lifestyle, and stress management.
Love it. So what are some common interventions? Like when you are, treating or addressing these issues with people, what does that look like?
So it looks like a huge one is stress. So part of that is finding a support system, whether it be a collective like Tourmaline or within your family, within other support groups. So support system is huge. Nutrition, which I won't get into the weeds about because I know you guys talk about it all the time.
No, let's
but I like
hear
to
it
make sure.
We want to know what that's why people are here. Is they want to hear, yes, people, they don't always want to have 15 different practitioners in their back pocket. They, if they could just go to the doctor and get enough information to at least get started and start seeing some results and understand that things are moving in a good direction. Because not everybody can afford, and then when I say afford, not only financially, but the time to go to the doctor and the dietitian and the pelvic floor therapist and the acupuncturist and until it's like their whole day, every day is just appointments, and that it can be very exhausting. So we would love to hear what your approach is. And also, listener, Dr. Jordi and I have our water bottles supporting our microphones here. So if you see us leaning forward and drinking like hamsters from their little water bottles, that's what that is. So we both have these for if you're just listening audio, you won't see these headphone/microphone contraptions that we're working with today, but they were rubbing against our clothes, so we had to either strip down, which we considered, but we would need to charge quite a bit
extra for.
Yeah,
it's a different service. Hey, before we hear about
fertility, OnlyFans.
Before we hear about nutrition and your perspective, let's take a break and hear from one of our sponsors.
We're taking a break to talk about our sponsor, Fertility Cloud. In working with hundreds of you ladies, we have noticed a problem that has come up. I know it's come up for me, Caitlin. It's come up for your clients as well. And that is not only finding a doctor who is going to know how to help you, but one that wants to. We have a lot of issues here, and sometimes getting a simple blood test or actually getting a medication or talking to someone who's actually an expert in fertility can not only take an insane amount of time, but it can feel like you're fighting your doctor.
Yeah, or you're playing like Russian roulette to get in front of somebody who actually cares. We are so excited to be partnering with Fertility Cloud because they have a solution for all of these frustrations. Just last week, I had a client that needed right now care, and we couldn't get her in front of an OB. And she got a same-day appointment with Fertility Cloud and spoke to a reproductive endocrinologist and had a prescription that she needed in her hand hours later. This is a solution that our industry desperately needs, and we are so excited to present to you.
So if you're in a remote area and you have to drive 4 hours to go see a doctor, or if you've been to multiple doctors and none of them seem to really listen or really care or want to take an approach that works for you, start up with My Fertility Cloud.
My Fertility Cloud has provided us a link, so check it out in the show notes. That will get you $25 off your first visit with one of their providers.
We're taking a quick break from this episode to talk about one of our sponsors, the Prenatal Nutrition Library.
We love the Prenatal Nutrition Library. It's a searchable database and app, which means you have answers within seconds and peace of mind that what you're eating during pregnancy is both safe and nutritious.
It's almost like having your own personal pregnancy dietitian in your back pocket that's going to not only tell you, is it safe to eat this? How much of that should I have? Yada, yada, yada. But give you actual meal plans so you know how to put it all together onto your plate today. And the meal plans are trimester specific, meaning, some women are kind of nauseous in their first trimester and maybe they need specific foods to help combat that. Prenatal Nutrition Library has got you covered. Or the fact that your baby's brain is growing rapidly in your third trimester and you need your nutrition to support that. Prenatal Nutrition Library meal plans has got you covered there too.
This is evidence-based information. Registered dietitians are in this app weekly answering members' questions. There's an exclusive podcast within the app that's run by Ryan, who is the prenatal dietitian that founded this entire thing. It's a wealth of knowledge and resources and will take you far beyond that one-page handout your doctor handed you that actually probably has out-of-date information about eating in pregnancy.
So head on over to the Prenatal Nutrition Library as soon as you get your big fat positive. Well, okay, first message me and Caitlin so we can do a happy dance with you. Then head over to the Prenatal Nutrition Library to get clear strategies to meet your nutrient needs, as well as to take the stress out of confirming what's safe and most optimal for you and your baby while you're pregnant. Use code FFF20 for 20% off.
And we're back. So Dr. Jordi, tell us a little bit about the nutritional approach you like to take. Of course, this is individualized and every patient is their own person, experiences, lab work, food budget, everything. But what are some key tenets that you're looking at for everyone in a preconception journey?
Definitely. So as far as diet goes, I always make sure we're eating full meals. I have a lot of people who skip breakfast and are trying to, lose weight, are trying to cut calories, whatever it might be. I want to make sure my patients are nourished. So this is a time that I always say, it's pretend you're getting sick. You're kind of coming down with a cold, right? What do you do to take care of yourself? You eat lots of nourishing foods. Perspective. You rest. You take time alone and to really reflect. And so I take that approach with nutrition as well. So I make sure we're eating plenty of nourishing foods, eating breakfast with high protein within an hour of waking up, balancing that blood sugar, huge.
Yes.
And making sure we have enough protein and vegetables for micronutrients at every single meal. So those are kind of, I would say, the baselines to make sure we're set as far as diet. And then nutritionally, I put them on a really good comprehensive prenatal, usually some fish oil. And then I always make sure that we're testing things like zinc and copper, and we're testing folate and B12 and vitamin D. Sometimes I'll even do an omega index so that we're getting an understanding of what's actually going on internally to make sure that we are providing the optimal nutrition externally for that specific person.
It's interesting to hear some of those, like, maybe not so conventional labs that you would run. Like, most people that go to their primary are never going to hear about an omega-3 index, right? So what would you maybe be looking for that would be vastly different from their annual wild woman checkup or just visiting the OB to get quote unquote cleared to go try to conceive? Like, what is your model of care? How is it so different in terms of lab work or other functional testing that you might order for someone?
Definitely. So there's a few things. As far as differing from the normal hormones we run, right? I make sure we're running everything from LH, FSH, prolactin, testosterone, DHT to estradiol, progesterone. We kind of get a good look at everything, including cortisol, to see how their stress is going. So hormonally, that's what we're looking at. I also run an autoimmunity profile because we want to know ahead of time if we have some higher antibodies, whether it be general antibodies, or we're talking about thyroid as well. I want to know if those antibodies are off so we can kind of support that before pregnancy, because while in pregnancy, our hormones go out of whack, our antibodies go out of whack, we're kind of predisposed to different things. And so I want to make sure that we're really supported ahead of that. So I always do a full thyroid panel that's including all the antibodies, thyroid hormones, including the TSH. I also do the nutritional profile that I mentioned earlier. Some people, I will optimize the gut microbiome, and we can even optimize the vaginal microbiome as well through stool analysis or vaginal microbiome analysis. On those kind of things, I really take it case by case to make sure that we are doing individualized medicine, because truly every single person is very different.
Okay, tell me about this vaginal microbiome testing and like what are treatments there?
Definitely. So there is a company called Tiny Health. I use them usually. They do a full vaginal microbiome test. It's just a swab. We test the vaginal microbiome because that's what the baby is getting seeded with, right? So as the baby goes through the vaginal canal, it's getting seeded with all these different microbes that are really important for their own gut health as they grow up. And so we test the microbiome. Now we can do vaginal suppository probiotics. We can also do oral probiotics, excuse me. We can do oral probiotics to make sure that the whole body is really nourished, the gut, the vagina, all the different microbiome.
Wow. So, okay, I've got vagina on the brain here. Let's talk more about that. So this is beyond somebody having like BV or yeast. This is like, what kinds of stuff do you see when you test for this?
So oftentimes with the vaginal microbiome, right, when we're looking at the gut microbiome, we can see different pathogens and different things like that. It's very complex. And so I want to make sure that in the gut, we're kind of killing off the things we don't want, adding in the things we do want, healing up that gut lining, right? And so in the vagina, our worries with BV and things like that are usually not an excess of things outside of, the actual bacteria that's causing the issue. You're more prone to having these bacterial issues, these yeast issues, if you have a deficiency in Lactobacillus reuteri and various different microbes that are needing to be present in the vagina. So that is on the level of, different issues that can come up. On the level of optimizing the microbiome for baby's birth, we just want to make sure that there is a lot of seeding of these optimal microbes and making sure that we have enough diversity in order to really seed that baby with the proper microbes.
And why, I mean, I know the answer to this, but for our listeners, like, why would you care about that? Like, what does this benefit the baby?
So now you're getting into my bread and butter, which is infant gut health. So there's so much different stuff, right? And so I'll actually run a microbiome test on infants a lot of times too. But there's different microbes that we really want to see in infants. And we want to make sure that we have those because it prevents things like colic, eczema, allergies, all these different things it can actually prevent in the future. And so if we can't get it initially, right, through vaginal birth, sometimes people have to have C-sections. Yeah, but we can do things about that too, right? And so that's where really optimizing the baby's microbiome postpartum can help that as well.
If somebody comes to this and they're like, hey, I already had 2 C-sections and 2 babies, and they're like 7 and 3. Is it ever too late to pay attention to this?
It is never too late. That's a great question. I actually have adults, especially when I was seeing a lot of autoimmunity, adults that'll come to me with, oh, I have these gut issues. I have this autoimmune disorder. I have these skin concerns. And we'll do a stool analysis, look at the gut microbiome, and we'll see a lot of stuff that's off. There are some specific microbes that I look for in kids and in older adults, such as Klebsiella, for example. I look at different things that can kind of upregulate the immune system, which can lead to a lot of different issues down the road. And so this is really easy to do when they're younger, right? Probiotics, breastfeeding, whatever we can do. It's a little bit more tricky down the road, but it's definitely still doable, and definitely for like a 3-year-old or a 7-year-old, there's a lot that we can do. They're still developing.
Okay. So pulling more into sort of your bread and butter here. When we look at the traditional care model, you have your baby and I can't even honestly speak to this very well because Caitlin and I both have only had home births. So we don't really know, but I from what I've heard, you like have a baby in the hospital, they put like creams in their eyes and like give them some shots and then send you on your way. And you have to go to the pediatrician like the next day or like really soon thereafter. So you sort of have to have like all of this stuff set up. And you need a plan for how you're going to parent your child and how you're going to care for your baby while you're pregnant, because you can't really even figure that out because they just sort of plop you on this conveyor belt and like away you go. They're just sort of doing these things standard to you, to your baby. And then before you know it, you're at this pediatrician's office and you're 3 days postpartum or whatever. And so you're just sort of trying to figure out your life. So let's talk about really early baby care and what sort of a more holistic or what someone like you or you would, what would that look like so young like that?
Definitely. So what you're saying is exactly why at Tourmaline and therefore through Thrive Wellness Collective, we do a lot of this childbirth education, postpartum and early baby care education in your 3rd trimester. And so a lot of parents already know a lot of these things. And then after birth, within 24 hours, we have a midwife at your home, and we have 3 or more postpartum visits in your home to check on baby, check on mom.
You don't have to lug. They're like, hey, don't lift anything more than 10 pounds, but also carry this car seat up 3 flights of stairs to get to our office.
And drive. A lot of postpartum moms, all your hormones are going crazy. You might have some anxiety.
That was so scary the first time driving postpartum with my baby.
And people don't talk about that. I have so many people that are like, I'm terrified to drive with my baby. It's the first time that this being is outside your body. So yes, we have midwives go to the house, postpartum visits for 6 weeks postpartum, actually.
Wow. And really treating mother and baby as a unit. The mother-baby dyad, instead of here's a visit for the mom and this doctor is a doctor for the mom, here's a visit for the baby and this doctor's a doctor for the baby. Really treating you, because birth happens, and yes, there is a separation physically now where you're not, within the same body anymore, but it's still a dyad. It's still to be treated as a whole, the mother-baby unit, instead of separating. That's really great.
Definitely. And that's kind of our MO too. So, and going back to your question about early baby care, right? One of the biggest things is going to be skin on skin contact. So I recommend wearing baby. Mom doesn't want to separate from baby, even though she might be tired, all those things. We often have people that are like, oh, and be helpful, let me carry the baby. When in fact, mom wants to bond with her baby. Mom wants to have the baby on her.
You just waited 40 weeks to hold this baby. The last thing you want is for someone to take it away so you can mop your floors or something.
Exactly. Yeah. You should mop her floors, make her food, bring it, allow her to have some alone time with baby. So that's one of the biggest things, is just really allowing for that bonding. and starting to breastfeed, latched. One of our programs through Thrive is lactation education and feeding education. So we have once a week lactation support groups at Cafe of Life Chiropractic in Pacific Beach. And we also have lactation home visits if needed. We have a milk donation program. So that's one of our big things is there's not very much education around lactation and really allowing the time for latch to happen. So that's a big pillar too. And then as far as, skin to skin contact, just holding the baby. I love baby wearing. I think it is incredible. As much as possible, having baby on you is also amazing. And then Caitlin, you mentioned baths, they really do bathe them right away, but we don't need that. Babies they're self-cleaning, right? We want all those good, again, with the microbiome, the skin microbiome is huge too. So just allowing baby to just be, oftentimes we have all this anxiety of, is anything going wrong? I need to do all these things, but really just supporting feeding, allowing them to sleep when they need to sleep, and getting that skin to skin contact and bonding. Those are the most important things.
Oh, I love that. Okay, let's take another station break and then talk a little bit more about this.
Hey guys, we're taking a break from our episode, and I want to talk about something that's super confusing. When you head down the supplement aisle and you're looking for a prenatal, and on the prenatal bottle itself, it says, do not take if you're trying to conceive, pregnant, or breastfeeding. Like, what the heck?
Yeah, it says talk to your doctor if you are pregnant, could be pregnant, breastfeeding, postpartum, whatever. And every supplement has this. You go down the supplement aisle, you go shopping on whatever supplement website, and there's a disclaimer on every bottle of every single thing, which means that everything that you've been taking your whole life long is now a big question mark about whether or not you are potentially harming yourself by taking something where you're trying to be healthy. So that is why we partnered with Needed. Needed is a perinatal nutrition supplement brand that has a wide array of products specifically designed for women who are pregnant, trying to become pregnant, breastfeeding, or postpartum. So it's not just that these products can work if you're in that situation, or it's probably okay if you take it while you're trying to conceive. No. These products are researched, they are formulated, and they are put together specifically for women who are trying to conceive, pregnant, breastfeeding, and postpartum.
This answers so many questions. I always get asked, what can I take? It's cold and flu season. What's safe? Needed has an immune support. That's safe whether you're trying to conceive, pregnant. It's even safe for your little ones.
And it's not just immune support. They've got collagen. They've got hydration support. They have digestive support. They have prenatal multi. They even made a line for dudes.
Needed is somebody we're really proud to be partnering with. So head over to their website and use code FFF20 for 20% off your order.
All right, we're back, and we're making fun of me for calling it a station break. I have been watching a lot of 90s Frasier, and they call it a station break, and I like to pretend I work at KICL in Seattle when I record these episodes. So station break just means we're going to hear from a sponsor. Okay, so Dr. Jordi, back to this. I just want to say another thing about this mother-baby thing. And if you're listening to this and you're like, oh my gosh, yeah, mothers actually, they need a break and they do want you to hold their baby. That is true to an extent when we're talking about something like, okay, hold this baby so I can pee.
Go pee. Take my first shower.
Stretch my neck for a second and just breathe for a minute. Okay, but we're talking about 15 minutes. We're not talking about you babysitting so that this mom can, I don't know. I mean, maybe I will say I did appreciate someone keeping my baby asleep and holding my baby so that I could take a nap. That was lovely. When I was early postpartum,
and when you have
need
other
that.
small children, you need somebody to maybe help with the baby care so that your toddler who's never been away from you for more than 6 hours is now barely seen you for 4 days. There are other reasons, but that should not take the place of your skin-to-skin contact with baby or the priority of you staying on your bed for a while and then near your bed. And then, we are way too quick to get way too far away from rest after one of the hardest things you'll ever do in your entire life, and an amount of recovery that needs to take place. So,
in a hormonal shift that is very delicate,
preach.
but also very strong. It is the most drastic hormonal shift humanity or any mammalian species encounters. It's more than puberty. It's more than menopause. It's more than pregnancy. Birth to postpartum is the hugest hormonal change. And it's very easy, as Caitlin and I both know, to get triggered for stress and end up having this like anxiety all the time because that postpartum time was not treated the way that it needed to be. And this is both with Caitlin and I, like, doing our damnedest to try to treat that postpartum period really respectfully. But we both had some breastfeeding issues and sleep issues, and it just ended up being much more anxious than we ever could have anticipated.
And as a medical community, we don't have enough of Dr. Jordis, frankly, who are looking out for both mom and baby in this moment. Like, I heard somebody yesterday share after having a 40-week and 2-day stillbirth, then having a live child after it, and telling their doctor, I'm having some kind of scary thoughts, and sharing what those thoughts were, and the doctor saying that's normal. Like, you know, everybody who's in and around birth a lot should not think that's normal, and make sure there's support around somebody who's having those thoughts with and without any prior trauma, but especially with the trauma that would come from something like that. You know, mom needs more support and probably needed a lot more counseling and medication than what was offered in an offhand. That's pretty normal for moms. So, you know, we're coming into a system.
Might be common these days, God knows, but it certainly isn't normal.
No. And we're coming, you know, we're in such a allopathic Western, you know, let's treat the problem rather than prevent and nourish and slow the F down. You know, we're not approaching birth and postpartum the way we should be as a culture. And so it's not surprising we have these two common cultural norms that we need to figure out how to disrupt and change. One thing I'm really thrilled to hear about, I came into this episode blind, everybody. I had no idea who Dr. Jordi was or what we were going to talk about. But one thing that's been, you know, a founding piece of why Sophia and I do this podcast is because Sophia and I can't treat everyone. Both, you might not be able to afford us. We might not have room. You know, free information or access to services to stuff like this is really important. It's really encouraging to see that there's a nonprofit around this in that area where people are being prioritized that may not be able to afford these services otherwise. I think that's really beautiful. And I hope that it's a model people will follow and multiply around the country.
Definitely. Thank you. And that actually leads me to we have a maternal mental health program. So we have not only the pregnancy loss. So if anyone has a pregnancy loss, and you can come to us at Thrive, apply for services, and that is regardless of income. You don't have to think about anything. You can come in. We'll do an hour-long visit with a midwife.
Okay. And what else? Tell us about that, because unfortunately, that is the side of trying to conceive and motherhood that I think gets swept under the rug more than anything else, is the fact that, and we're going to have Allison on, the illustrious Allison again, to talk about, you know, life and loss and life and death, and how we don't really have control over it the way that we would like to, or the way that we think we do. And often in allopathic circles, they make it seem like, oh, well, you need to be here in case something happens, or we have these tools in case something happens, to make you think that they have some power over life and death. And they don't. It's a lie. It's an illusion. They really don't have that. And when you are opening yourself up to life, becoming a mother, you're also opening yourself up to loss and to death. Life and death are opposite sides of the same coin. And it's a sad but very real and very common experience that not every time you see a positive test or beyond, does this mean you get a baby in your arms to keep? And we want the mothers listening to this to be acknowledged and to know that there's more than just, oh, well, try again. Oh, looks like you didn't expel the gestational sac. We'll do a D&C and just flush this away down the medical waste tube. And, come on back when you're pregnant again.
Exactly. And we have a lot of people that go into the ER and they're not educated in the ER on how to emotionally support and physically support a miscarriage. And so that's what we do is we have the visit with a midwife that will help you with the physical side and with the mental health side. And then you can put a butterfly. We have these white butterflies. You can write a little note to your lost child. You can write their name, whatever it might be. You can just put it up there. And it is directly across from all the Polaroids we have of all the babies that were born at our center through Thrive or not. And so it's a really beautiful way to remember your baby that was your baby, that
Amen.
you form a connection. You are growing this baby in you. And in conventional medicine, it's just, oh, well, that's, it's done. Next. When you're pregnant again, let me know. It's like, this is an incredible loss. And so we really try to support the family in that. And that kind of goes into also every person who comes into care for birth services with Tourmaline and with Thrive, they meet with our psychotherapist because we want to be able to identify different tendencies. Are they more likely to have postpartum depression or anxiety or psychosis? Are they fully supported in this pregnancy? Because if you have trauma, it's gonna come out in birth. Birth is an extremely
straight
intense.
up. That was so my experience. Oh my gosh, yes. It comes out in birth. Yeah, go on about that. Don't let me interrupt you, but I just felt very lightning bolted by that.
No, please. And if you have a personal experience with it too, it's even more powerful. Like we have people who, you kind of push things under the rug, right? Because it's comfortable. We don't want to address trauma. And what happens is you're going through the most intense period of your life in birth. Very intense. And things come up and a lot of people will just freeze, right? Because that's our trauma response. And so if you're freezing.
Or numb it. They'll be
numbing
like,
it out.
Okay. Yeah, I want to be like my cousin who just got an epidural and an IV of fentanyl and was just watching episodes of The Office until they told her it was time to push. And
Yep.
that's the birth experience that I'm looking for.
Definitely. And so we're trying to kind of address that trauma before it can come out in ways that we don't want it to, or, make sure we're addressing it before they're pushing it down, getting an epidural, even schedule C-section, whatever it might
And
be,
listen,
and
there's
kind of not addressing
these
it.
are medical procedures that have, there's a time and a place for these things, but
Certainly.
it's just like there's a time and a place for a glass of wine for most people, but there's times when you're drowning away something that actually really needs to get dealt with. And there's times where you're trying to escape something that's actually going to be transformative and important for your journey as a mother. And instead of trying to numb it, to shove it down, to escape it, to medicate it, to face it. And that was really what, in my first birth, what my midwives were saying to me is they were like, don't hide from this. Stop trying to hide from these contractions. Stop trying to hide from this pain. This is what brings the baby. Face it, embrace it. Almost like, I think at one point they were even like, open your eyes, like just come right up to this. Let this tear you open emotionally. And it was so much. I mean, my midwives in my first birth physically did very little. I mean, there was definitely some like hip support and some like, perennial support when I was pushing and that kind of thing. But for the most part, they just were I kept it very, very dark. And they were like in the shadows as me and my husband were going through this journey together. And I would just sort of like yell out whatever was going on. Like, I can't be a mom. I'm not ready. Or I kept coming up. I can't be a mom. I'm not a mom. I can't be a mom. Thinking that like now I'm going to have this baby that I have to take care of and I'm not ready and I can't do it. And that was what kept coming up for me again and again and again while in labor. And they really helped me to face that, to embrace that, and to realize, I mean, truly, I remember being like, I can't do this. I can't be a mom. And Nicole, the lead midwife, saying, Sophia, you are a mom. Like, you've been carrying this baby all this time. You've loved her for so long. Like, you are already a mom. And it was very true. But yeah, boy, the transformation that comes from that, and how when you maybe don't even realize the trauma is there because you've just gotten so good at living life with it. It just is a part of you, and it's just the way that you function. But it will come up and it will come out in birth. And Caitlin, I know that you experienced these things as well. I know your husband moved through a lot during the birth of your children as well.
Yeah, I think that we've really done ourselves a disservice to not learn more about birth, for birth not to be more normal. You know, you see it on TV where women are screaming at their husband that you did this to me and I never want to do this again. And I was just thinking, hearing you talk, Sophia, about how, I was kind of scared of birth for my first. My second, I was like, I had such a quick and fast birth, which I wasn't expecting. It was so intense. I don't know why I wasn't expecting that. Obviously, it was going to be that. I was like, well, why prepare for my second? Because it's just going to be hard and I just have to like live through it. And I approached my third so differently and felt so much more triumph from it. But I still wasn't looking forward to it. And we're in this season of, are we going to have any more? If we have more, will they be biological? And there's almost this yearning in me to do birth one more time, because I think
I have that too.
This time I would look forward to it. And I almost want to live through that. And that's not a reason to have a child. But I would almost live through it, because you can almost see this evolution of self in that I am now so confident in my ability to mother. I'm so confident in my ability to birth. I am so confident in my ability to nurture and comfort and just all that is maternal within me. And I see it as strength and I see it as beauty. But in those moments of pain and rapture in my first childbirth, I remember thinking something's wrong and I'll never be able to do this. And there is something transformative about that. And there is trauma, and it will come out in birth. But you know where else it's going to come out is in your postpartum. Like maybe if you end up miraculously getting through birth without experiencing trauma, or maybe you had an experience with birth that wasn't what you hoped, and so the birth itself was very traumatic. Mm-hmm. You can't just swallow that away when you're sleep deprived, your hormones are changing. Your whole identity as a human is changing, because now you have this thing to always care about and think about. And I remember thinking about my husband the first year, like going back to work and thinking, he goes to work and comes home. I go to work and think, my baby's taking a nap right now. Well, this is about when my baby's going to wake up. But like that dyad of a mother with their child is so special, and it never ends. It never ends. It just changes. And in this idea or this conversation about trauma is like, you won't hide from trauma you haven't addressed. If you can start addressing it early in pregnancy or even in fertility ahead of time, or at least realize it's there so that when you have the bandwidth to start processing some of these things, it will only serve you and serve your children and your motherhood, like just being the healthiest that you can be mentally, physically, spiritually, all those things. You have to look into the fire. You have to face it.
Look into the fire. Yeah, it's so true. Oh, what they say in my husband's training, they say, eat the pain. But I don't want to really say it like that, because in the training that he went through, like they are deliberately like torturing you to like see who's going to crack and like who can stand it and who can't. Birth is not like that. It's not a trial from some divine entity that's like seeing if you've got what it takes. Like that's not what's happening. It's intense, and there are moments of pain. but it's not deliberately a torturous thing. And that's, man, we also have to really shift our view away from that. That here are your options: torture or drugs or surgery. What do you want? Pick.
And that's where the fear in birth comes through, right? You see in the movies, you hear these stories of people like, oh my gosh, I'm screaming and it's the most painful thing in my life. And there's all this fear around birth versus I want to hone in on both of you guys mentioned transformation, transformative, and it can be incredibly transformative, this birth portal, right? You're going through this and it can be in a transformative time in your life, not only transforming into a mother, but also who you are as a person undergoing such intense pain and such intense feelings, emotions all at one time and getting through that, right? And so I think that's where like having enough education and really birth prep to where you're surrounding yourself with the right people, with the right energy, right? And so you're going into birth thinking, oh, this is going to be a lot. This is going to be intense. This is going to be transformative, and seeing that as a positive thing and really being proud of yourself at the end of it. I think that is incredibly valuable.
Yeah, very valuable. And then your postpartum experience, like what you are saying that you and your colleagues offer, that it doesn't have to be this like thing that the comedians talk about where you're like putting an ice pad on your shredded vagina and this horrible squalling baby is chapping your nipples while your husband just yawns and plays Candy Crush on his phone. Like, it doesn't need to be an experience like that. And you might have moments where you sort of feel like that, but there is so much more to be had. And when you are cared for, like this last postpartum for me, I was really cared for. I had my mom come and stay for the first 3 weeks of my baby's life. She arrived just hours after I birthed my baby. And she took care of my 2-year-old, who wasn't even 2 yet at the time. And she took care of my baby every night. I would sleep in, because sleep was a huge issue with my first. And that traumatized me probably more than anything, with the sleep deprivation and the anxiety surrounding sleep and all of that. So my husband took care of our firstborn at night, and my mom took my little newborn baby from the day she was born, and slept in the room next to mine. And when my baby would wake up, she'd bring her to me just to nurse. And then my mom would take her and she would do the burping, the shushing, the settling, the diaper change, all of that kind of stuff. And so I would just whip out a boob and go right back to sleep. And that was all I had to do for 3 weeks. Like after the first night of this, the first night I was like, Mom, you have to do this, because I had lost so much blood and it was a 53-hour labor. Like I was just a shell of a human being at that point. So she did it the first night, and the next day I was like, okay, whoo, like I'm feeling a little more steady. I'm feeling okay. Can you do it again? Do you want me to take the baby tonight? And my mom was like, no, this was the sweetest night of my life. She just slept and looked at me, and she was so sweet. And so I had this support baked in with my mom being here for my 2 children and for me, that made it to where I was able to have a much more blissful postpartum experience. And I knew what I was going to need. And so I had different kinds of food on deck. And having a home birth, like what you were describing, all of the baby visits, all of the postpartum visits, they all were conducted in my home. And I had this care team that was asking me about how I'm sleeping and how I'm eating, and checking to make sure that I am, looking like I've bathed, I've eaten, I'm not sitting in a dark room, that these little things like opening up the windows for fresh air. They told me that me and my baby need to be getting sunshine on our faces every day during the day. And so we would open up all the windows in our bedroom, and they positioned like a chair for me to sit in with her laying on me, so where the sun would come through the window onto us, and like just this much more holistic care. And I absolutely had that with my first, but I didn't have my mom there doing the sleep thing. So that was a big difference. But having that sort of support to where postpartum doesn't have to be this hellscape where you're just like so tired and your body's all effed up and you just hate everyone. It can be extremely joyful where all of these hormones and feelings that you're having serve a great purpose to set the tone for you as this new mother.
Yeah, and I think that every mom is different, and that's where having someone like your mom there is huge because she knows you. She's able to see your cues, actually listen to you. And even for people who don't have access to someone, that close to them, a postpartum doula is an option. Just having yourself really supported around you so that your needs as a mom are being met, because every mom's different. Some moms really need a moment to sleep. Some moms get a little stressed being away from their baby. Some moms, it's all different. And so it's all about really supporting that individual person and what they need at that time.
Absolutely.
Well, that seems like Caitlin, go ahead.
Well, one thing I want to say is, I think we get so caught up in what we've been around that we forget how humans have lived for thousands of years.
Right?
Your mom and your sister and your best friend who you grew up with since you were both toddlers running around in the dirt in your village would have been having babies around you. Your mom might have even had a baby when you had a baby, because people had babies so much younger, and you were, 16 with your first baby. Your mom's 33 and she can breastfeed your baby. There was just so much more baked in support if there were things that were going wrong. And certainly we have more medical advances and this and that. And
hygienic advances, like back then. People are always like, well, babies died. I'm like, yeah, people didn't have soap. They didn't understand how to wash their hands.
Yeah, or placenta previa killed you, and it didn't. You didn't have a C-section. So I don't want to say it was so much better back then, but what I'm trying to say is our nervous systems and our bodies could not adapt to the technology advances in the last 100 years. So something as simple as slowing down and getting sunshine on your face and opening the blinds and regulating your circadian rhythm to the earth and the sun, these things are not sexy. They're not expensive. They're not a pill. They don't happen overnight. They don't fix things like a Viagra can make someone hard. We don't have the same immediate benefit that some of these other very quick solutions have. But they are so aligned with how we've been created and how we've been placed here to interact with our surroundings that I think oftentimes there isn't enough voices saying, sit by the open curtains during the day and help your baby learn what daytime is and get fresh air. And we need your milk to come in to help this jaundice resolve. We're so quick to just put babies under lamps, but we're not looking at mom and
put
going,
them on formula.
Yeah, why isn't your milk coming in? What's going on? And what can we do to support you? And, looking at these more kind of traditional models of care, we have experts that look at it from a different way than just the normal Western medical model. But I think sometimes we need to slow down and I'm sitting recording this podcast looking out at a tree that's been living for probably 80 years and the shade moving on the ground as the sun moves it. And I'm I can feel my nervous system coming down just on this call looking outside at nature. What would happen if I went and sat in nature? What if
walked your feet in that cool grass?
Exactly. I think sometimes we try to medicate, over advance what is really actually very fundamental, simple human needs.
Definitely. And I will say these medical advancements save lives, right? They're incredibly important. But America has the highest maternal mortality rate of any developed country right now. And we're so quick in our model of care to treat birth as an emergency. Every birth is medicalized, it's an emergency, it needs to be quick, in and out. And in that, we do have a higher maternal mortality rate, poor outcomes for birth, for baby and mom. And so that's where the model of, I was talking to someone recently from England, and, you go to your midwife appointment and you birth with your midwife unless you are high risk, and then you go to the OB. And in America, it's not safe to birth with a midwife at home at a birthing center. You have to go to the hospital. What if something happens?
And
right?
You're crazy for not getting this epidural. You need to have this. You're crazy. Hey, don't eat that turkey lunch meat sandwich. That's bad for the baby. Put this fentanyl shot in your back. Like, oh, okay. That makes a lot of freaking sense. Yeah, but like, you're crazy for not getting this. There's something wrong with you for not doing this. You're putting your baby at risk. You're so selfish.
That's the big one. And we aren't listening to moms and medical professionals, midwives, OBs. Medical professionals are able to tell if it becomes an emergency, if it becomes high risk, right?
And
we have very clear guidelines.
You are able to tell. You know when something's wrong. It's your body. It's your baby.
And especially even more now. You're
not a stupid infant who can't figure out what's going on with your body. If something's up, you're the first to know. You are the one that gets to decide whether or not you're high risk, and whether or not these things that might be variations on normal actually mean you need medical help. Because
that maternal instinct kicks in.
Yeah, exactly. Because you know what, sister? It's also possible to have everything look completely normal, and for no medical professional to say anything's wrong at all, but for you to know that there is. Just like it's possible for medical professionals to say, oh, well, this was 2 points too high and this thing didn't look good and blah, blah, blah. But when you sit with your Holy Spirit connection with you and God, when you sit with your connection between you and the baby and you say, we're good. I don't care. That doctor said I've got this thing wrong with me. I just don't think that that's causing the issues that he thinks it's causing. And it's possible to say, I know you're saying everything looks fine. I know that it isn't. And I know that I need something. When I say
medical professional, I'm in the world of midwives, right? So I'm thinking, your midwives would be able to talk to you. But I will say that's where really coming into your body, really coming into your body throughout pregnancy and throughout birth, and not disconnecting and having it be this fearful thing. And it really allows you to connect and think internally of like, how am I feeling? How is my baby doing? And if you're really disconnected, you can still do it because you are innately now a mother. But it's going to be a lot easier to come to you, and it's really comfortable when you're just like, okay, I'm in my body. What am I feeling right now? Let me check in with myself.
It's a great spot to say. I feel like we gave it to him today. I don't know. I think we could have you on, Dr. Jordi, and do a whole episode on like, what does birth to 12 look like for naturopathic care? And I have so many more questions, but we made it to an hour, and I think that we still have a sponsor to hear from and some girls to celebrate. So let's hear from our last sponsor, and we'll come back and celebrate together.
Hey, it's me again, Sophia Pavia, registered dietitian nutritionist specializing in women's health, fertility, and optimal progesterone production. And I'm interrupting an episode of my own podcast to tell you about my online course called Ovulation Unlocked. So if you've been listening to our podcast episodes, you've probably heard a lot of things about basal body temperature, cervical mucus, cervical position, and tracking your fertility. Well, I have designed a 90-minute self-paced online course, which I titled Ovulation Unlocked, that puts all of that together and teaches you how to be the expert on your own fertility from home. This course is designed to put you in the driver's seat of your own fertility, not only so you can know what's going on with your body on any given day, but so that if you need medical help, you can show up to the appointment informed and ready to communicate. Too frequently, us women show up to our doctor's appointments and just say something like, I want to have a baby. And the doctor looks at you and says, good for you. Stop using birth control, start taking a prenatal, come back in a year if you're not pregnant. And that's all we get. However, Ovulation Unlocked puts you in the driver's seat, puts you in control of your fertility to where if you need help, you can show up to that appointment informed and ready to communicate your needs. So if you want to become the expert on your own body and your own fertility, head on over to my Instagram bio and tap the Ovulation Unlocked link today.
Okay, we're back, and I have got a girl for you. My girl is that I'm going on a girls' trip.
It's a fun,
with
yeah, girl.
Caitlin, and with another guest we had on the show, Michelle. And we're meeting at Caitlin's cousin Star's house. We've talked about her on the podcast before, the one that has what we have decided are the easiest births, where she just like sneezes and out comes her baby. I'm sure she feels like it was not that way, but that's what it, anyway. We're all getting together, and we're gonna go to Seattle, and we're gonna get a hot tub boat.
I know, this has inspired the whole trip. I saw this like ad on Instagram for these boats that go out on Lake Union, and it's like a hot tub in a boat, and it's just you guys on it, and you can bring drinks and yada yada, and we're all not
like
pregnant at the same time, and we could go.
We're all not pregnant or immediately postpartum at the same time, and so we can actually get together.
So fun.
So we're doing it. I'm going. Yeah, girl. And it's all coming together so sweetly, and I'm just really pumped. We're still like a month out, but I'm so excited.
You'll be here tomorrow. It'll come so fast.
Yeah.
Sounds so fun.
So fun. I was telling someone about it yesterday, and I was like, I've never been away from all three of my children, and I've never been away for a few nights from all three of them. Like this is going to be a really big thing for me.
Mm-hmm.
Never done this. Pretty excited.
It is going to be a really big thing. I know. But I'm glad we're all sort of feeling the same things. Like Caitlin and I are already like planning the wines we're going to have. And like we're already thinking like, what are we going to bring? And what are we going to do?
Who's doing body work?
Who's doing body work? Who's sleeping where? Yeah. We're so excited.
So fun. Jordi, do you have a girl you want to celebrate?
Yeah, I think mine is going to be that I meal prepped for like the 5th week in a row.
Wow.
And that might not sound that crazy, but if I don't meal prep on Sundays, I'm going to get Chipotle. I'm not eating that great, right? And so my husband and I have started meal prepping, and it's so hard to stick to. But after this, I'm going to go heat up my meal that I made on Sunday. And sometimes it's the little things that just make life a little bit easier. That's definitely my goal today.
So how much time are you dedicating, just so our listeners can understand this sort of investment of like, how much time are you dedicating to this on Sunday? How long does it take?
It takes, let's say it takes an hour to grocery shop and probably 2 hours to cook. We cook 5 meals a piece, so I cook 10 meals. And then we also cook breakfast, which is just, for us, it's turkey patties, and I make like a homemade tzatziki with sheep's milk. I love cooking though, so we really get into it, and it actually is a really enjoyable time for the two of us too. We kind of do it together. He kind of cleans the house while I cook, and it works out pretty well.
That's so fun.
I love that. So 3 hours of work, listener, on one day a week equates to how much time saved throughout the week?
Oh, I don't even know. Probably, it would be 7 hours probably. It would be a lot. And it really also decreases the stress, because
the mental load of like, what am I going to eat? And when do I need to get it started so that I have it when I'm hungry?
Or I have, back-to-back meetings. I guess I'll just have a bar. That happens all the time. And so really just like setting aside the time and prioritizing it has just really regulated my nervous system throughout the week.
Amen.
Oh, I love it. So we're always sort of saying like, just an hour. Like, let's say you even just did the planning what you're going to eat in the grocery shopping portion. Mm-hmm. That alone is going to cut down on so much stress and so much in the moment decision fatigue. And oh my gosh, there isn't time to make something healthy.
Exactly. And I told myself before I needed it to be a habit, and now it's a habit. And so now every Sunday I don't even think of it.
I love it.
I also love that you and your husband are doing it together. I often encourage couples, like, I think the woman is always so quick to be like, I need to meal prep, I need to do this, I need to do that. And we focus on our own fertility issue. And it's like, well, you're a family, and you're also trying to grow your family. You need to feed that family. And so everybody should be involved in some way in this process. And I have encouraged couples to like turn meal prep into a date, like turn the music on, have fun with each other, tell jokes, watch a comedy show while you're doing it. When it's done, like put on some music and dance around the kitchen together, and just like make it fun. Because I think a lot of people dread it because it's work, and then there's all the dishes to do, and you don't think like, I saved all those other dishes throughout the week, I'm not going to have to clean. And I just spent an hour with my partner instead of us sitting on the couch with our phones, not looking at each other.
Straight up, dude. That seems like all we do lately. Oh, well, yeah, girl. Thanks, Jordi, for sharing that it's possible as well. Oh, I have one more. Yeah, girl. I got my eyebrows done for the first time since my eye surgery. And I'm looking at my video here, and I look like me and not my grandfather, and I'm loving it.
I love that you said
Yeah,
that.
girl.
I
Yeah,
do.
girl.
Okay, one of these. Okay, I'm going to get a picture of Valerio Alphonse Polsinelli, and I'm going to show it to you so you can see the stark resemblance of me to my grandfather when my eyebrows are grown out.
You're so funny, Sophia. Okay, girl, I'm gonna like continue the food train.
Yeah.
We moved to a new neighborhood, and it's just like such a different feel from our last neighborhood. Like, a man walked over to meet us the other day with his wife, and he brought us homemade sourdough. And then this other neighbor whose children keep coming over to play with our cats brought me her fresh tomatoes. And my other neighbor has way too much basil. So like everybody brought me all this food in the last few days. And I was like, man, I'm going to make a meal to honor just like what the neighborhood has given us. So I was going to do a really typical summer meal we do is like a strawberry salad with a burrata and a balsamic situation. It's so good. We do it about once a week in the summer. So I had all those pieces, but I was like, we're changing this. We're going to like honor the basil and the tomato and the sourdough bread. So I made this super yummy basil, lemon, kind of vinaigrette almost. Didn't have vinegar in it, but it was like an essence of like a creamy pesto kind of.
Mm-hmm.
And we dressed arugula and spinach, and I chopped all the tomatoes up and broke apart the big yummy burrata ball. So we had like the creamy mozzarella all in it, and put whatever other veggies I had in my fridge in it. And then we took the sourdough, and I just gave people big warm chunks of it and like super dressed the salad. And it was like the dinner table was silent except for like nobody was talking. It's like, when was the last time I served a salad where it was so delicious nobody talked? I mean, salads are good, but not that good. The salad was like, and it was so fun.
Next
I sent a
level,
message
wow.
to everyone, was like, this was like the neighborhood dinner, and it was so delicious and so fun. And
Wow,
and
and it's really wonderful to hear how you're just connecting with your neighbors and just
yeah,
enmeshing in this neighborhood. Because I know you had a good friend in your last neighborhood, and you had the community pool, and it was like a
yeah, but
lot
it
to
was
leave.
like, yeah, but it was also like we were right on top of each other, and it was kind of just like track homes new. Like, I'm looking at trees in my backyard right now that I look at and my nervous system calms down. You know, it's just like a
Oh
different
yeah.
feel. I'm just really thankful. So, but that was a really yummy dinner. I'm still dreaming about it. It was only last night. So we might have to I'm going to have to figure out what I did to make this salad dressing and post a recipe about it. It was so yummy.
All right, well, there you have it. There was another episode of Food, Freedom, and Fertility. We are thankful that you joined us for this time. If you liked it, please rate, review, and subscribe so you never miss an episode. This might sound trivial, but it helps the women who need us most to be able to find us. The algorithm is real, and it prioritizes certain things. So take a second to hop into the app where you're listening to this right now and give us a little rating and review. Hey, it's Sophia. If you love the show and want to continue your health and fertility journey using our resources, head on over to foodfreedomfertility.com for show notes, links to products and services, information about our guests, and our newsletter. Again, that's foodfreedomfertility.com. Thanks for listening.